Okay, so if you've ever gotten a cholesterol test, you probably zeroed in on one number, right? Your LDL, what everyone calls bad cholesterol. For decades, it's been the main character, the big bad wolf in the story of heart disease. But what if that story is missing a huge piece of the puzzle? What if the real villain has been hiding in plain sight this whole time?
And that really is the big question we're digging into here, because the science is pretty clear now. LDL cholesterol, or LDL-C, can be, well, a pretty flawed way to predict your actual risk. I mean, think about it. Tons of people with what doctors would call perfectly normal LDL numbers still end up with cardiovascular disease. So yeah, something is definitely missing from the picture.
And that missing piece, it creates what you could call a cholesterol blind spot. It's this gap in how we've been looking at things, and it can leave a lot of folks with a totally false sense of security about their heart health.
Now, hang on. Let's be super clear here. LDL-C is important. I'm not saying it isn't. For more than 30 years, lowering it has been the absolute cornerstone of preventing heart attacks and strokes. It's the number your doctor's laser focused on, it's the target for drugs like statins, it's the number we've all been taught to worry about. But it's just not the whole story.
The problem, the real kicker, is this thing called residual risk. And this is so important to get. It's the danger, the risk that's still there even after you've done everything right and gotten your bad cholesterol down to that target level. So hitting your LDL goal, that's awesome, but it is absolutely not a guarantee that you're out of the woods.
And we're not talking about a tiny, insignificant problem here. One huge clinical trial found that almost 1 out of every 4 patients, 22.7% to be exact, still had a major cardiovascular event, like a heart attack, even though their LDL-C was supposedly at the perfect recommended level. That just goes to show you relying on that one single number can leave a massive, massive blind spot. Okay, so if LDL-C isn't the whole story, then what is? Well, the answer seems to be in counting the actual particles themselves, not just looking at what's inside them. So it's time to introduce you to the real main character in this story, apolipoprotein B.
Apolipoprotein B, or let's just call it ApoB for short, is basically the protein that makes up the outer shell of every single one of those artery-clogging particles floating around in your blood. And here's the magic key. The part that changes everything. There is exactly one ApoB molecule on every single one of these bad boy particles. So what does that mean? It means measuring your ApoB level is like doing a direct head count of the total number of enemies you're facing.
So let's break this down with an analogy. Think of LDL-C on the left here as measuring the cargo. It's the amount of cholesterol that's packed inside each particle. But here's the thing. The amount of cargo can be totally different from one particle to the next. Some are stuffed to the brim, others are practically empty. Now ApoB, on the right, it couldn't care less about the cargo. It just counts the total number of particles themselves. Think of them as the delivery trucks, and it's the sheer number of trucks on the road that causes the traffic jam in your arteries, not necessarily how much stuff is in each truck.
Okay, and this is where it gets really interesting. What happens when the numbers don't line up? When the amount of cargo, your LDL-C, and the number of delivery trucks, your ApoB, are telling you two completely different stories? Well, that's a phenomenon called discordance.
And don't think this is some rare, once-in-a-blue-moon thing. For about 1 in every 5 people, that's 20% of patients, these two numbers are discordant. They just don't match up. Which means for literally millions of people, their standard cholesterol test could be giving them a dangerously wrong idea about their real risk. All right, let's just look at this chart for a second to see exactly what this means. The first 2 rows, super simple. If both your LDL-C and your ApoB are low, your risk is low. Great. If they're both high, your risk is high. No surprises there, right? But now look at that 3rd row. This is the one that matters. Here, your LDL-C looks good, it's low. But your ApoB, that particle count, is high. So what does the science tell us? Your risk is still high. The risk follows the number of particles, not the amount of cholesterol.
And hey, you don't have to take my word for it. This is a direct quote from a brand new 2024 statement from the National Lipid Association. These are the experts. They're basically saying flat out that when the numbers disagree, cardiovascular risk follows ApoB. It's simply the more reliable guide to what's really happening inside your arteries.
So the next logical question is, who should really be paying attention to this? Who is most likely to have this kind of misleading discordance? Well, it turns out it's especially common in a few specific groups of people.
If any of these sound familiar to you, we're talking type 2 diabetes, obesity, or a high waist circumference, high triglycerides, metabolic syndrome, or insulin resistance, you are way more likely to be in that situation where your LDL-C looks perfectly fine, but your ApoB particle count is actually dangerously high. For anyone in these groups, relying only on that standard cholesterol test could be a really big mistake.
Okay, so now you get the key idea. The whole cargo versus the delivery trucks thing. But what are you supposed to do with this information? Well, the goal here isn't to just throw out the LDL-C test. Not at all. It's about adding a much more powerful tool to the toolbox so you can have a much smarter conversation with your doctor.
And the great news is, we now have really clear targets for ApoB that line up with those familiar LDL-C goals. So for example, for someone at very high risk, the goal isn't just to get their LDL-C under 55, it's also to get their ApoB under 60. This gives both doctors and patients a second, and frankly more accurate number to shoot for when they're trying to manage risk.
Now I know what you might be thinking. A better test must be super expensive or hard to get or complicated, right? But here's the best part. The ApoB test is actually cheap and it's widely available. It's a direct measurement, not a calculation like LDL-C usually is. You don't even have to fast for it, and it stays accurate even when other things like your triglycerides are high. I mean, it's just a better, more solid test in almost every single practical way.
Which, brings us to the final and maybe the biggest question of all. If ApoB is more accurate, more reliable, and more practical for figuring out cardiovascular risk, why isn't it part of every single standard cholesterol panel? Why are we still so focused on a number that might be leading us astray? Whether you're using this to get up to speed for a book club, prep for a quiz, or just to get a better handle on your own health, that's a question that is absolutely worth asking.